Skin scent offers hope of early Parkinson's diagnosis. Parkinson's disease is a progressive neurodegenerative disorder marked by tremors and movement difficulties. A test based on the smell of the person's skin may allow early diagnosis of Parkinson's disease. This is due to chemicals secreted by patients with the disease. The study was inspired by a super sniffer who detected a distinct odor on the skin of her husband, who had Parkinson's disease, later in his life. Joy Milne, a former nurse, noticed how Biles had a different odor 5 years before he was diagnosed with Parkinson's disease. This led to a test that can offer early diagnosis of Parkinson's disease and its progression. The research is led by Perdita Barron, Professor of Mass Spectrometry and Director of the Michael Barber Centre for Collaborative Mass Spectrometry, University of Manchester, United Kingdom. They identified a molecule fairly hydrophobic and may be dissolved in oily material from the sweat of Parkinson's patient. The smell is stronger when the symptoms are less controlled. This happens in early stages, when the symptoms are less well controlled, or at later stages, when the drugs aren't working as well. So it is useful not only for early detection but for monitoring the efficacy of therapy also. The skin has long been known to be affected in terms of changes in the oiliness, and some people have flaky changes in the skin. Now there's also smell that goes along with it. This is useful in terms of an early detecting biomarker for Parkinson's disease. Currently there is no diagnostic test for Parkinson's disease. If there's some way to detect the disease in a part outside of the brain that's more easily accessed, it would be a very wonderful thing. Early diagnosis allows to treat people early, which may slow down the progression of the disease with a better outcome. Hoping for better days to come. Thank you.